The air quality in Delhi and nearby cities has reached hazardous levels just a day after Diwali, with the widespread violation of the firecracker ban across the national capital region on Sunday. That's actually raised pollution concerns. Whether it's Kartavya Path, Majlis Park in Delhi, AIIMS, whether it's Azadpur and the adjoining areas as far as Gurugram and Noida is concerned, the air crisis in Delhi and large parts of North India is quite visible. And it has come to be framed predominantly as a failure of environmental and public health management. But the intriguing puzzle, though, as we've seen in the past 2 days, is not the repetitive nature of the crisis, but the collective inability to fix or even substantially mitigate this problem. Now, for further clarity on the medical emergency that's emerging as a result of this toxic air that you can see on your screens, joining us on the broadcast, Dr Vivek Nangia, Principal Director and Head Pulmonology from Max Hospital, Saket in New Delhi. Vivek Chattopadhyaya, Senior Program Manager from the Centre for Science and Environment. Also with us, Public Health Expert, Dr Anurag Mehrotra, who is also the Chairman of SIDH Hospital. Thank you so much, doctors, for making time for us this morning and joining us on the broadcast. Dr Nangia, many hospitals and medical experts I've been speaking to in the National Capital Region have confirmed that outpatient departments are seeing a threefold rise in patients with pollution-related complaints. Have you witnessed a similar pattern yourself?
Yeah, absolutely. I would agree with I would agree with all of them. You know, most of the patients who are coming...
And you're coughing yourself. Exactly. So I understand that the repercussions are being felt across the city and the region.
So we are getting a lot of patients, not just in the OPDs, but also in the indoors. Patients getting admitted with breathlessness, with cough, with chest pains. There's some patients who are even developing acute cardiac events and reaching the hospital. Of course, you can't label them as because of the air pollution, but it seems to be related to the air pollution only.
Right, Dr. Mehrotra, you know, I haven't heard so many fireworks also in a long time in Delhi. Either there's a ban or there isn't. And if there is a ban, someone is not performing their duty. Now, while fireworks may not be the primary cause of pollution, there isn't any denying that they do have an adverse impact, right?
Yes, of course it is. It is like super saturation. Our environment is totally polluted, and as you said, it is really difficult to maintain the level of standards which is required to keep the environment clean. It is costly affair. We are a transformational society. And everything is the cost of everything. Every industry want to keep the cost low. Even the most important cause of pollution is vehicular traffic. We don't have that much of rapid transport system, though they are developing at a very fast pace, but still it lacks what is required. Our industrial output systems are still requires further regulations. The type of emissions they give into environment is not good. But it all involved cost. It all involved resolve. It all involved strong political resolve, not the infighting and the type of show we see on the TV in political party on this matter. We did need a serious thinking what we are going to have from this pollution. As we know, there are more than 7 million deaths which occur because of pollution. There's increased morbidity, mortality, all the things are there. I suppose as we are understanding the problem, and the channels like you which raise these issues will go a long way in understanding the things. And main issue from my point of view is restraint part of at a personal level, as you said, in the burning the firecrackers. By every individual instance is cause harm, but the restraint is not there. So this is incremental thing over and above the existing level of pollution which has caused this.
Right, but indeed, political blame game is not the answer or the solution to this problem. Mr. Chattopadhyaya, you know, in the annual World Air Quality Report that's released by IQAir, which in case our viewers are not familiar, is a Swiss firm, India is actually ranked 8th among countries with the worst air quality index. Even worse is the fact that 14 cities from North India actually occupy the list of 20 most polluted cities in the world. Mr. Chattopadhyaya, what measures do you think have really worked so far to tackle this toxicity?
See, various measures have been taken. Like we have now one of the toughest emission standards for vehicles, new vehicles. But we have legacy vehicles which are very old. Certainly, we need to deal with them. But there is a huge laxity in enforcing norms for power plants and industries. Certainly, we need to find solution for small and medium scale industries. Clean fuel is a major challenge. Coal is still predominant fuel of use, but however, wherever the piped natural gas is available, it is being promoted. But price parity has to be there, and we have to have a policy reform which taxes the polluting fuels more and incentivizes the cleaner fuels more. But however, we have a reverse policy. Our cleaner fuels are very costlier and taxation on polluting fuels is very less. And what we see today is the collective failure of the governance as well as lack of thinking that goes behind in clearing the air, because we are not shameful about being on the top spot worldwide. 16 cities are like in top 20, and whenever any nation wants to becomes a developed country, certainly it values the value clean air. All the worldwide reforms that you might see, whether
Of
it
course, it's
is
a basic necessity, sir. Clean
UK
air, clean
or
water.
yeah, several countries, they have worked very hard on cleaning the air. I think environment is the top priority to become a developed country. That priority is not there. Our political leaders are not talking about clean air. Nobody is talking about our religious leaders must advise people that pollution actually kills you. It's not a harmless thing. Somehow it has become part of custom, but becoming a part of custom itself has repercussions. I think people are not understanding, and unless until people are educated well, kids are now more aware than the adults. Adults are actually need to be more made more aware. I think it's a collective failure and very sad situation in terms of air quality in across India, in all cities, including Delhi. Delhi is the capital. Delhi has to show an example to the world and to India that how a capital can be clean so that they can learn. If we are not able to clean our capital, how we can expect a smaller city or medium ranked city to be clean?
Indeed, crucial
So
points you're
I think
highlighting there.
certainly.
Dr. Nangia, some doctors have warned that no amount of exposure to air pollution is safe, and that a child born in the Indo-Gangetic Plain today is taking in smoke that's equivalent to about 20 to 25 cigarettes a day. What's your analysis, Doc?
So, there was a recent study which actually showed that all of us living in this Delhi NCR and the Indo-Gangetic Belt actually have reduced our lifespans by nearly 11.9 years, which is really significant. There was also a study which was conducted when in 2015, the then president of the US, Mr. Barack Obama, had come to India for just 3 days around the Republic Day. That is the 25th, 26th, and 27th of January. And the analysis showed that his lifespan was expected to be reduced by 2 hours per day. One cigarette is equivalent to 2.5 micrograms of, the AQI level. So if the AQI is about 300, then you can expect that your cigarette smoking is about 15 cigarettes in a day. So that is a level of the toxic air that we're breathing in every day, actually. And it's not just the children, but the adults are being equally harmed. There are studies which have shown that people living the students of Delhi have poorer lung functions as compared to those who were probably in South India somewhere, where there were greener areas. So I don't think we need any studies anymore to confirm that how the poor air quality is actually damaging our lungs and damaging our health.
Of course, you're absolutely right. In fact, the report Dr. Nangia is highlighting, it asserts that the lifespan is being reduced by over 11 years, which is absolutely a very worrying statistic. Dr. Mehrotra, Delhi still needs to reduce levels by between 55 to 59% to meet the national standards for the PM 2.5 levels as per experts. So there's no disputing that the scale and speed of action has to be highly disruptive. What do you think should Delhi focus on now? And is it best to stay indoors for the next few days during peak pollution levels? What's your advice?
Sure. We have to guard ourselves against the environment, and whatever we can do, we should remain indoor, outdoor activities. They should be avoided. It is not only that we should look into our health also closely. We should undergo a regular health checkup. And it is not only when we have disease we should go to the doctor.
Indeed.
We should go to the doctor to assess our health itself, as the doctor was saying. It's a dangerous game. It is not only mortality, morbidity is very high. This is the season when upper respiratory tract infection also occurs. And they lead to this pollution increases the incidence of those infections also. And they lead to serious consequences. So we have to look into this.
Also, as we wrap, Mr. Chattopadhyaya, lots of talk regarding cloud seeding. What's your opinion? Can artificial rain tackle the air pollution crisis of the scale that we're currently seeing as far as the Delhi and the National Capital Region is concerned?
Artificial rain is not a kind of solution. You need to have rain-bearing clouds in order to have artificial rain. It is possible only in those areas. But also there are implications of artificial rain, because silver particles will be used and there are several chemicals will be used. They will fall upon in the air and ultimately we will breathe. So I think these are not the solutions to clean up the air. And for example, people are setting up smoke towers. But what's the point in polluting the air first and trying to clean up? Indeed. So I think we need to have a thinking that we need to reduce pollution at source, and all the sources are known. And if there are unknown sources, they can be identified. We are reaching to moon, but we are not able to handle our air pollution problem. It's not a rocket science. It is doable.
Right, there's no disputing that effective solutions do require reductions in multiple sources of emissions, as our doctors and Mr. Chattopadhyaya have highlighted. Thank you so much, gentlemen, for joining us and making time for us on NDTV.